Hi, good evening. Today our topic of discussion is the Alzheimer's disease. And what are the important points on Alzheimer's disease? First of all, what do you mean by Alzheimer's disease? So, it is the most commonest cause for cortical dementia in the old age patients. Next, what do you mean by dementia? So, it is a state of global mental failure, so which leads to the functional impairment. Next, along with dementia, it also causes agnosia and aphasia and agraphia and acalculia as well as with the other cognitive defects. Next, it is a slow progressive disease where the memory impairment is the first sign and most important sign. So the entire pathology was present around the memory. Next, along with the memory, so it also causes the impairment of cognitive function, and it also causes the inside thinking. It also causes the impairment of the judgment. It also causes the kind of recalling process. And next, along with that, sometimes the paranoid features like delusions and hallucinations may also be present. And on advanced disease, sometimes the patient may become rigid and mute, and sometimes the bedridden. Or in the very rare cases, the primitive reflexes like rooting reflex and snout reflex will also be appears again. Next, where the pathology will present or pathogenesis. The pathogenesis of the Alzheimer's disease will appear as accumulation of beta amyloid protein as well as formation of the neurofibrillary tangles or NFTs. Along with that, amyloid angiopathies as well as the neuronal loss will be seen. So the two most important pathogenesis are formation of beta amyloid protein, yes, which is presenting as an extracellular and toxic to the nervous tissue. Plus, this is the early sign of Alzheimer's disease. So the formation of beta amyloid protein is the early sign of the Alzheimer's disease. And the second one and the most important thing is the neurofibrillary tangles. So these are nothing but hyperphosphorylated as a microtubular proteins, or these are also known as the tau proteins, tau proteins. These are presenting as kind of intracellular proteins. So they are presenting on soma as well as the proximal dendrites. Plus on accumulation of these, so they also causes disruption of axonal transmissions as well as disruption of the impulse conduction, or sometimes disruption of the essential substances from the soma to the dendrites or axonic flow, which leads to the death of the nervous tissue. Okay. Plus, these are the intracellular intracellular fibrillary tangles. On death of the nervous tissue, they may appear as extracellular. Next, Alzheimer's disease. So this is the most commonest appears in the old age people and female age. Plus, and the decadent head injuries, as well as the low education level people, as well as the decadent as well as female groups will be commonly affected. Along with that, aluminum as well as mercury poisonings are also will be seen. Next, on macropathology, so there is the diffuse and gross cerebral atrophy will be seen and causing the secondary enlargement of ventricular system. Diffuse and gross cerebral atrophy with the secondary enlargement of ventricular system is the most prominent feature. Okay. Next, what are the proteins or neurotransmitters are affected? Simple. The most important one is the acetylcholine. Acetylcholine was decreased. Along with acetylcholine, the cat protein as choline acetyl transferase was decreased. Plus, nicotine cholinergic receptors are decreased. Plus, somatostatins was decreased, as well as serotonin was decreased, as well as the as well as the norepinephrine will also be affected. Next, and what are the genetic factors? So what are genetic factors that are associated with the Alzheimer's disease? So the most important one is the Down syndrome. With Down syndrome, and the amyloid precursor protein is there, as well as presenilin 1 gene and presenilin 2 genes. So these are the commonly associated genetic factors of the Alzheimer's disease. Along with that, so there is increased level of the homocysteine levels will be seen, plus so plus hypertension will also be associated with this Alzheimer's disease. And next, yes, what are the stages of the Alzheimer's disease? Yes, what are stages of the Alzheimer's? So the first most important thing is the memory impairment. So Korsakoff, yes, memory impairment will be seen. Next, it also causes the dysautonomias. So there is interruption of the functions, or there is sudden interruptions of the writing, or sudden interruption of the walking, or sudden interruption of the thinking. So dysautonomias. Next, and third one is visuospatial disorientation will be seen, like car parking. So the patient doesn't know how to park, how to park the car suddenly. Next, and best example is, so there is a difficulty in wearing the sleeves, whether it is right or left sleeve, on wearing the shirts. Okay. Along with that, fourth one is paranoid personalities, as well as hallucinations, as well as delusions will also be appeared. Yes. What are the commonest differential diagnosis for Alzheimer's disease? Alzheimer's disease. So the commonest diagnosis for Alzheimer's disease is the Pick's disease, or Pick's disease. So Pick's disease is nothing but is a frontoparietal dementia, but Alzheimer's disease is the temporoparietal dementia, and hippocampus is the commonest area that was affected in the Alzheimer's disease, where there is short-term memory was converted into the long-term memory, plus and amygdala will be affected, plus a basal nucleus of myeloid will also be affected. So this is about the Alzheimer's disease. Next, what are the important points in Alzheimer's disease? So the first and most important thing is this is the commonest cause for cortical dementia in the old age. Plus, next, pathological beta amyloid protein accumulation, formation of the neurofibrillary tingles is the most important. Next, amyloid angiopathy is the next important point. Plus, diffuse and gross cerebral atrophy with the secondary enlargement of ventricular system is the important point. Next, the most important point. Next one is the decrease the acetylcholine levels are most important point. Next, so the commonest duty for Alzheimer's disease is the Pick's disease. Next, so this is mostly and pathology is mainly focused on parieto-temporal area. So these are the important points of Alzheimer's disease.